I've had a question from someone, I don't know the name of this person, they're known as 512 according to my records. It says that they've heard that the supplement GABA, G-A-B-A, can be helpful with RLS, but it's not available in the UK, only online from the States. I don't know if you know about it, but if you do, can you comment on whether it's safe or not?
I haven't heard very much about it, certainly not available in the UK, and currently it's not in any of the guidance. The thing we follow at the moment is something called the Mayo Clinic algorithm, which is worth having a look at because it tells you sort of the current state of things. But the American Academy of Sleep Medicine, I think that's right, yes, are also going to be launching a guideline. They've gone through consultation, so the final version should come out in the next few months. And I'm going to certainly be recommending that clinicians in the UK follow that guidance whilst we're waiting for the UK to catch up.
Right.
Because unfortunately it is difficult because NICE sort of says not everybody gets augmentation, therefore we should still recommend it, but just warn people it might be a problem. And I don't necessarily feel that's the right approach, and I'm somebody who's actually been involved in writing NICE guidelines, so not on RLS, I hasten to say, but I know how NICE works, and it is quite slow moving and very conservative when it comes to recommendations. So the CKS, as you say, is not a full NICE guideline, and we have again approached NICE to say, can we have you do a full-blown guideline, because that would actually give a much more robust guide, especially to secondary care colleagues, because the clinical knowledge service is mostly used by GPs.
Well, I was interested that you mentioned that. As I said earlier on, you've just mentioned it. There's only a CKS, a clinical knowledge summary, on the NICE website. What weight does that actually have in guiding GPs or other practitioners in dealing with any problem, but in this case RLS?
It has a degree of weight, but nowhere near the same as a full NICE clinical guideline. It's developed by a group of people who have an interest at SOD, and they look at it and they've got pharmacists and various other people who write it. But if you compare that with the sometimes over 3-year process to come up with a full NICE guideline, the ones I've done, by the time we get to the guideline development group, there's 2 years left in it. And there's really complex searches done and a lot of work done to try and come up with the perfect guidance. And I would much prefer to have that. Now, that's being mimicked by the European Academy of Neurology, who are doing a guideline on RLS. Interestingly, they've just put it back slightly because they're moving to looking at sort of minimal clinical significance as opposed to just statistical significance, because it's a problem. If you've got something that's statistically significant but makes so little difference nobody can notice it, what's the point? So they're moving on that. Right. So we're getting a series of them coming, and it's slowly moving towards the UK. But NICE is pretty busy with guidelines, and of course it's having to redo existing guidelines. I've done 2 redos in urology, which is my clinical interest area. So again, each of those is still taking 3 years to do. We did one guideline on meshes, pelvic meshes and things, and that was an enormous amount of work and stretched out to only 4 years.